This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. It is October, and of course, it's Breast Cancer Awareness Month, and we continue our series on the breast cancer services available at Mon Health. Joining us this morning is Oncology Nurse Navigator Tricia Julian with Mon Health Cancer Center. Good morning, Tricia.
Good morning.
We'll be talking about support this morning for breast cancer patients, but before we get into the topic, let's talk about you for just a minute or two, Tricia, if you don't mind. Give us a little bit about your background. Tell us, where you're from, your education, and how you ended up with Mon Health.
Well, I've been a nurse now for, I can't believe it, 46 years. I've been an oncology nurse for 36 years. I got both my associate and bachelor degree from Fairmont State University. And I have 4 children, so I would work for a while, then quit to have a child, and then go back. And I finally, when I went back to work on a full-time basis, I came to Mon, to the oncology unit, and that was around 1986. So I worked on an 18-bed oncology unit here, loved my job, but it got to the point where I needed more time at home with my kids, and that was because I live in Fairmont. It was a long commute. So I ended up taking a job in Fairmont for 18 years, kind of taking care of the cancer program there at Fairmont. And after my kids were grown, I got an opportunity to come back here to this hospital, which is where I really wanted to be. And I came back here 4 years ago. I love this hospital. I love the people that I work with. And it was a great move for me. So that's how I ended up back here.
What drew you to nursing all the way back in the day, Tricia? What drew you to the nursing profession and the medical field, for that matter?
Well, my grandfather was a physician. I had several aunts, and my mother, who was a nurse. I now have a sister who's a nurse, a sister who's a physical therapist. So the medical field was very strong in our family, and I think that's probably what drew me to it. I have always loved caring for patients and caring for animals, actually, too. So I think I have, probably due to my mother, a very caring nature.
Talking to Tricia Julian this morning, Oncology Nurse Navigator. What is a nurse navigator, Tricia?
A nurse navigator is a nurse who takes patients on their journey through their trajectory of their illness. They start with them at the beginning and work their way through the whole process and help them with anything that they need assistance with along the way. I often tell patients that I don't have all the answers, but I know who to call to get answers for them. So I act as kind of their liaison to get to whatever they need to get to. Education is huge with the role of being an oncology nurse navigator. Probably my favorite part of my job is taking patients who are newly diagnosed and arming them with education to get through the process of their treatments. So I do the education with almost all of the newly diagnosed patients. Education is a valuable tool and can really arm them with what they need to be able to get through the process of treatment.
How does that really put or help ease the patient's mind a little bit? Cancer is very scary, especially breast cancer. And how does that information or having that person who can get them that information really help kind of relax the patient in some ways?
Well, it's really terrifying when you're first diagnosed. You have this brand new diagnosis. Most patients have absolutely no experience with it. And it's a terrifying thing, and your mind is racing 1,000 miles a minute thinking, how am I going to get to treatment? How am I going to get through this? What is going to happen here? What is going to happen there? And I go in and sort of calm them a little bit and give them a synopsis of how the whole treatment plan is going to go. And having that knowledge, knowing that ahead of time is really invaluable to them. There are many times that I will go down and get a new patient down in the office who has just been told that they've got cancer, and I will sit and talk with them for a few minutes, bring them up to the infusion center, show them where they're going to be getting treatment, and it just helps to alleviate their fears. Little things like knowing what to bring with you to treatment and what appointments you have and excuse me, in what order those appointments need to go. Those types of things are what I can help with.
You know, it's amazing, though, Tricia, those little things, how much and how huge of a help that is when you have this major diagnosis, and just the little things like you said, what do I need to bring to treatment? Do I sit there the whole time? Can I read a book? Can I do this? Can I, you don't know, and why would you know if you've never gone through it? So those little things, it's amazing how much of a relief that is for someone with something that like a breast cancer diagnosis weighing on them.
It is so true, and I also, one of the other things that I do is to hook them up with programs that we have that will be beneficial to them. We are a COC, or a Commission on Cancer accredited facility, and as such we have a lot of standards that we have to live up to for that accreditation, and we have so many programs for our patients, particularly for breast cancer patients. We've got things like I can help with assistance with transportation, with getting them signed up for Medicaid if that's needed. We have a wonderful program called Revital that helps with patients' stamina and helps with patients who have had breast cancer surgeries and may have some strictures with their arms and with their chest muscles, and they can help with that. So all of those programs, I can help navigate them toward whatever it is we feel that they need.
And talking to Tricia Julian, Oncology Nurse Navigator, this morning, and you've kind of touched on it, but we have been talking breast cancer awareness all month long. So can you be a little bit more specific on your role with the breast cancer patient?
Yes. So what often happens is we have a breast health navigator, Maria Ham, who is responsible for helping the patient get scheduled for their breast biopsies and so on. And if there's a patient that needs specific help, Maria will call me. Sometimes the physicians will call me if it's a patient who is particularly anxious or has a specific need. If they're going to need to come to radiation therapy for 6 weeks and perhaps they live a good distance away, they will get them hooked up with me to help with those services and just to help them kind of learn the system and know what to access and what they need to do to get that access.
Talking to Tricia Julian, Oncology Nurse Navigator with Mon Health Cancer Center. Got to squeeze in a quick break. We'll continue our conversation in just a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning is Tricia Julian, Oncology Nurse Navigator, Mon Health Cancer Center. We've been talking about breast cancer patient support. Tricia, when we've talked all month with regards to breast cancer treatment, the comprehensive plan. We've talked to oncologists, we've talked to the surgeons, and again, you've kind of touched on it, but what part of the conversation. Where do you come into this conversation as the team, and it really is a team effort, develops the proper treatment plan for the patient?
It absolutely is a team effort. The physicians, the radiation oncologists, it was our team up here in the infusion center, the team at the medical oncologist's offices. Those all work together to make up a comprehensive plan for the patient. And then my role in this is to identify the programs that are needed by this specific patient and direct them toward those programs that are needed. And also, as I mentioned previously, do the education with them.
What are some of the concerns you hear most often from patients that maybe you're uniquely qualified to answer?
Well, they will ask questions regarding their diagnosis. Of course, they might ask questions about the genetic predisposition, and those questions are fielded to our genetic professional that we have here, Jess Four. We're very lucky to have her here, and I can take those questions, answer the ones that I can answer, and then refer them to people who are who have more knowledge than I have in a specific situation. But as I said before, I tell them that I don't have all the answers, but I know who to get the answers from for them.
I got to think, Tricia, with all of the medical jargon and technical terms and all the conversations you have, how often does somebody just want to know, am I going to lose my hair during the treatment?
Is. Yes, that is. Sometimes with some patients, that's the number one concern. And so we have a couple of programs here that I am really, really proud of because no other hospital in the surrounding areas have these programs. We have a wig bank and we have a bra bank. The wig bank, we've got beautiful wigs, hats, scarves that we can offer to patients. And very often when they're concerned about hair loss, even before they've lost their hair, and I can take them back to that wig bank and show them what we have available, and they know that they're not going to be out there on their own, that we have the resources for them. It often will alleviate some of those fears for them.
So are these free services then for any patient who wants to use them, or how do the wig and bra bank work?
These are absolutely free services. We've been blessed with a foundation that in our administration that funds our wig bank and our bra bank. Our supplies were given to us by Mon Health equipment and supplies when they were no longer going to carry them. And so all of these services are available to any patient out in the community. We believe very strongly with our oncology program that we should serve our community and not just our own patients. So these services are available to any patient out in the community. The bra bank, we've got the mastectomy forms, we've got mastectomy bras, I even have a few swimsuits, and we have a very nice little fitting room upstairs that I can take patients to. I'm not a professional fitter, but we can usually get patients fitted with whatever they need for up there. And with both the wig bank and the bra bank, everything is completely free of charge. So if a patient starts on a treatment and perhaps they're not going to lose their hair and they go through that treatment and then they're getting ready to start on a different type of treatment and they will lose their hair with that, at any time during their treatment, they're free to go to any of those services.
Talking to Tricia Julian, Oncology Nurse Navigator. And Tricia, what kind of reactions do you see from patients when they are fitted for a wig or fitted for one of these bras?
Oh, my goodness. That's probably one of the most heartwarming parts of my job, taking a patient back there to the wig bank who is so tearful and so worried about what their appearance is going to be following hair loss, taking them back there and getting them a beautiful wig, or showing them how to put the scarves on and the hats to mask the hair loss. It is just so heartwarming. And I have taken several patients up to the Bra Bank who, a lot of times insurances will pay for those bras and those forms, but there are some cases. I had one woman who had a house fire and lost everything but the bra that she had on in the form. So she came to us to get more supplies immediately. So in situations like that, patients are just so thankful for these services.
Is that located here in Morgantown?
It is located here in our hospital. The Wig Bank is up on 3rd floor where my office is located. The Bra Bank, the hospital gave me a patient room and a patient bathroom that we use for a fitting room, and that is up on 4th floor. But those things can all be accessed by patients calling me at 304-285-2622.
Got to squeeze in one more break. We'll conclude our conversation with Tricia Julian, Oncology Nurse Navigator with Mon Health Cancer Center. In just a moment, you're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Got a couple of minutes left with Tricia Julian, Oncology Nurse Navigator. And Tricia, it is our final breast cancer show for the month of October. So I would be remiss if we did not mention getting your annual or getting your regular mammograms and other breast cancer screenings. Where can patients get those done?
Patients can get 3D mammograms at our facility here in Morgantown, the one in Fairmont, Grafton, Weston, and Kingwood. And if they want to get scheduled, they can visit our site at monhealth.com/mammogram.
And how can people reach out to you, Tricia?
People can get in touch with me by going to our website at monhealth.com/cancer. And I wanted to mention one other program that we have for not only breast cancer patients, but any patient who is affected by cancer in terms of sexuality. We had a program last year on a cancer diagnosis and sexuality, and it was so well attended. This can be a huge impact. We are seeing patients younger and younger with a breast cancer diagnosis, and this is a huge concern for a lot of patients. So we're doing a second program on Wednesday, November 16th from 6 to 8 p.m.